Hello, everyone. Looks like we have everyone starting to join us right now. Welcome. This is the Patient-Centered Primary Care Home Program's Learning Collaborative for Standard 2F on Staff Vitality. While everyone's getting joined, I'm going to have Laura Lee go to the next slide for us. All right, so while you're joining us, just a little bit of logistics and some Zoom etiquette here. So this learning collaborative is being recorded, just so everyone knows. If you have any technical challenges, go ahead and actually chat Amy, Amy Harris. She can go ahead and help you out if you're having any sort of technical challenges. To facilitate really a shared learning and connection, we would really love to see everyone's faces. So if you could turn your cameras on, that would be great. Also, if your name is not visible, if you go ahead and just rename yourself, include your organization. It's great to see where everyone's from. There's 3 little dots at the bottom of your picture that should help you rename yourself. And then finally, if you have any comments or questions as we're going along today, feel free to put those into the chat. We'll definitely have some question and answer sessions and pauses during this learning collaborative, and we'll get to all your questions. All right, let's go to the next slide and talk about today's agenda. So we're going to start out today with a bit of an icebreaker and just get everyone awake and engaged. We'll then go ahead and talk about Oregon's PCPCH model. We'll talk about some general technical assistance resources that we have for you all. And then we'll get into PCPCH Standard 2F on Staff Vitality. We'll talk about the background of the measure. We'll go over the measure specifications. And then we're going to go ahead and review a toolkit that some of my colleagues have created for you. And then finally, we're going to do some PCPCH practice sharing. So we have members from Family Health Associates as well as Evergreen Family Medicine with us today, and they're going to share how they do this and how they do this work. And then we're going to end with some more resources and some information on our next learning collaborative session. So let's go to the next slide and do that icebreaker. So before we get the question up, how we're going to do this is you're going to see the question. I want you to type your answer into the chat. Don't hit enter just yet. And then we'll all hit enter together and see everyone's response all together. So go ahead, let's pull that question up. And our question is, on a scale of 1 to 5, how comfortable are you with Standard 2F? And again, type your answer, don't hit enter just yet. 1 would be you're really unfamiliar with this measure. Maybe you're brand new to the program. Maybe you've never attested to this measure, but you're interested in it. And then 5 would be you feel really, really confident in this measure. You feel you're excelling at it. So type that answer into the chat. And then let's go ahead and all hit enter together and see where everyone's at. So I see lots of 2s and 3s, some 3.5s. I definitely saw a 5 in there. I saw some 1s, a 2.5, 4. Which is great. It sounds like there's a lot of people who can learn today, and hopefully we can also learn from you all and learn from our presenters. Some more 2s. I think everyone, it's a lot of 2s and 3s in there, 2.5s and 3.5s. So lots of learning. Make sure you have questions. Type your questions into the chat. There's no silly questions. All right. Looks like we're done. No one else has any more in the chat. So let's move on. And we're going to start talking in the next slide about the Patient-Centered Primary Care Home Program. So the PCPCH program was established in 2009 by the Oregon State Legislature as part of the state's broader transformation effort to achieve better health, better care, and lower costs within the health system. The intent was to improve Oregon's primary care system by developing a set of standards for primary care practices. So after that legislation was passed, a volunteer advisory committee was convened to develop the PCPCH Standard. The committee has reconvened several times since to refine those standards. There are more than 600 primary care clinics that are recognized as PCPCHs in Oregon, which is about 2/3 of all the primary care clinics in the state. They are recognized in 35 out of 36 counties in Oregon, and approximately 3/4 of all Oregonians get their care at a PCPCH. And PCPCHs, they can range in size from clinics with 1 provider to clinics with over 200 providers and clinical staff. Let's do that next slide. A little bit more information. So participation in the PCPCH program is voluntary, and the recognition is attestation-based. So as part of the program, we conduct site visits to a select number of PCPCHs each year to verify that clinics are meeting the measures they attested to. The PCPCH recognition criteria is defined by 6 core attributes, each with specific standards under each attribute and measures that indicate the extent to which a clinic is meeting that standard. There's 11 must-pass measures that all clinics must meet, and then there's over 50 optional measures that are worth either 5, 10, or 15 points. There's also 5 tiers of recognition based on which measures a clinic is meeting. Go to the next slide. So our next slide is some technical assistance resources. So the very first one, and as we go through these, we'll drop links into the chat, but the very first one is that PCPCH 2020 Recognition Criteria Technical Specifications and Reporting Guide, also known as the TA Guide. That's the document that everyone's using to attest to the program. It has all the documentation required. It's really sort of the manual to the program, how you meet these measures. The next link here is a link to our PCPCH listserv, and that's where you can receive PCPCH program monthly updates via email. So those emails include things like program changes, upcoming TA opportunities, and then other helpful information about the primary care health system in Oregon. That's also where we advertise a lot of these learning collaboratives. So hopefully you guys are all signed up for that. And if you're not, please feel free to sign up. And then the last link here is to the PCPCH program website. So on the website, you can find things like extra guidance one-page documents for select standards and measures. There's also recorded webinars for select standards and measures, as well as an overview of the entire PCPCH site visit process. Included in that are links to the recordings of these webinars. So this one will be there. Our previous learning collaborative links are also there. And then finally, you can also find resources to assist your practice with health equity initiatives. Okay, next slide. So to start, we want to review the basics of 2F, which is the standard about staff vitality. The standard has 2 measures that increase in complexity and point value. This is not a must-pass measure, it's a progressive measure, meaning PCPCH practices can either attest to 2F1 or 2F2, but not to both. So the measures are as follows. I'm going to read them out. 2F1, PCPCH uses a structured process to identify opportunities to improve the vitality of its staff. That's worth 5 points. And then 2F2 is the PCPCH develops, implements, and evaluates a strategy to improve the vitality of its staff. That measure is worth 10 points. Next slide. And we're just going to go ahead and talk about some background to this measure. So there's a 2018 Medscape survey. Oregon ranks in the top 10 states in proportion of physicians experiencing burnout or a feeling of physical, emotional, or mental exhaustion, as well as a frustration and cynicism related to work and doubt about their competence and the value of their work. The problem has only worsened since the COVID-19 pandemic. In the 2023 Medscape survey, 53% of physicians reported they are burned out, which is an increase of 11% since that 2018 survey. Provider burnout can result in significant consequences for clinic staff, including a diminished sense of personal success, premature departure from their jobs, substance abuse, depression, post-traumatic stress disorder, and suicide. Burnout may also result in lower quality care for patients due to high staff turnover, increased medical errors, increased risk of malpractice, and reduced patient satisfaction. So Standard 2F was developed by the 2019 PCPCH Standards Advisory Committee in response to this epidemic of provider burnout. Research suggests that both individual focus and structural or organizational strategies can result in meaningful reductions in burnout. Research includes strategies for increasing staff satisfaction with some of the processes and workflows encouraged by medical home models, such as the PCPCH program. Let's go to the next slide. So before we dive into the measure specifications and the details of each measure, I want to review the definition of vitality as well as the intent of the standard. And these are as written in the TA guide. So vitality in the TA guide is defined as the state of being strong and active in energy, morale, and/or within physical, mental, and emotional realms. The intent of the measure is that staff vitality contributes to the sustainability of providing high-quality, patient-centered care. Activities that support the safety, well-being, work satisfaction, growth, and the overall morale of practice staff may positively influence the quality of life for everyone at the primary care home, including patients. Next slide. So with that in mind, we're going to take a closer look at measure 2F1. So the PCPCH measure 2F1 is all about identifying opportunities to improve staff vitality. A practice is meeting 2F1 if it is able to define its ongoing strategy for addressing staff vitality, including methods used to gather feedback from all employees to be completed at least once a year, how the results of the feedback are shared with the entire staff, so that's things like emails, internal newsletters, all staff meetings, and then also actions taken by the practice that directly impact staff vitality and are based on the employee feedback. That's like really the important part there, is that they're based on that employee feedback. Go to the next slide. So we're going to move on to PCPCH measure 2F2, which focuses on developing, implementing, and evaluating a strategy to improve staff vitality. So a practice is meeting measure 2F2 if it is able to define its ongoing strategy for addressing staff vitality, which includes, again, that method the practice uses to gather feedback from all employees completed once a year, how you're sharing those results with the entire staff, the actions taken by the practice that impact staff vitality that are based on staff feedback, and then the big difference between 2F1 and 2F2 is this last bullet point, which is how these actions or activities are monitored and evaluated for progress or success. So we're going to go to the next slide, and I'm going to pause here. There's a lot of talking and there's a lot of reviewing of the measures. And I want to see if there's any questions from anyone out there, or if there's anything that we can clarify on the measures or how it's written in the TA guide. Don't see anything coming through. And I think the big thing that I know we talk about at the program a lot is that last piece on 2F2, that evaluation and monitoring piece. And that's the big difference, again, between 2F1 and 2F2 as when you look at it in the TA guide. We don't see anything in the chat, so I'm going to go ahead and kind of move us along because the next thing that we have to talk about here is the toolkit. So I'm going to hand it over to my colleague Kamar to talk about that.
Great. Thanks, Bernadette. Hello, everyone. I'm Kamar Haji Mohammed. I am an improvement specialist, a part of the site visit team. I will be sharing highlights of the toolkit the PCPCH team created for this learning collaborative. Rachel is going to drop the link to the toolkit in the chat if you'd like to follow along. We created this toolkit to help facilitate the implementation of Standard 2F and help explain its requirements step by step. The intent is to ensure that practices that choose to attest to this standard and its measures have a roadmap of what is expected. In it, you will find templates and examples of required pieces that were created by the PCPCH team, and you will also find examples from PCPCH practices across Oregon that have implemented these measures successfully. As the PCPCH team, we hope this toolkit gives practices valuable information and ultimately makes your implementation process a bit easier. Next slide, please. There are 4 main parts to this toolkit. First is assessing the vitality of your staff. This section includes different methods practices may choose to utilize. There are examples for larger and smaller teams. Next slide, please. The second part of this toolkit is acting on survey results or feedback from staff. This section has a summary of how any action or activity created should have a direct link to the feedback staff provided. You will also find ideas on different topics practices could ask their staff about, from work-life balance to safety, communication, and so forth. And you'll see all of that listed as well. Next slide, please. Next section is evaluating progress. In this section, we included ways to solicit staff feedback on the actions and activities implemented. There are multiple examples on how to evaluate that process. Some very easy steps, such as adding an evaluation question onto your yearly survey that you may already have. And that is what it's showing here. And then next slide, please. And finally, the toolkit includes a best practice section that walks you through how to create a written staff vitality strategy. While this is no longer a required element for this standard, it may be in the best interest for the practice to create a written strategy document that includes the practice vitality process in its entirety, from the assessment tool to the evaluation process and all. And you'll see all kind of the different pieces that may need to be in there. And then next slide, please. One of the templates the PCPCH team created for this tool is the Plan, Do, Study, Act, also known as a PDSA cycle. This tool helps guide practices to go through the staff vitality process, improvement process step by step, and can be used to satisfy one of the documentation requirements for the measures. The PDSA tool prompts you to ask all the important questions related to improving and reassessing staff vitality. It will help keep track of the vitality process and make the necessary changes requested by practice staff. So you'll see kind of the 4 pieces there listed. And then the next slide. Thank you. As site visitors, we have worked with smaller practices and smaller teams who have informal, ongoing discussions with their teams on staff vitality. This tool, the Staff Vitality Discussion Questions for Primary Care Homes, created by the PCPCH team, is specifically created for smaller practices and teams. It is designed to help structure the discussion so that staff needs can be identified and documented efficiently and evaluated for future improvements. So you'll notice these questions are open-ended to help with fruitful discussions that can ultimately lead practices to make impactful changes for their staff. So that's a lot that I went through there, but you do have the toolkit in the chat, but if anything comes up at a later date as well, you can email our program. Amy, and next slide, please. Questions for the toolkit? I think, let me check the chat. I don't see any questions related to the toolkit, but yeah.
It also looks like we did drop the specific link to the template that Kamar just went over, that PDSA template and that discussion template. There's the link to the toolkit, and then there's also a link to those templates. And to remind everyone, they are also available on the website. So if you ever lose those links, you can always go to our website, and in the little search bar, you could just type in 2F and find all the relevant resources to this measure. So I'm going to give it another minute or two and see if there's any questions. Hopefully that toolkit, you all find that very helpful in meeting this measure. Okay, all right. Well, we're going to move on. So we'll go to the next slide. And that brings us to the point in our presentation where we have some practice sharing. So the first practice that we have with us today is Family Health Associates. And so I'd like to introduce Jolene Horney, who is the practice manager, and is going to tell us about how they meet this measure. Jolene,
hi all. You can all hear. I hope you all can hear me.
We can hear you great. Thank you.
Perfect. So my name is Jolene, and I've been with Family Health Associates for about 3.5 years now. I started in January of 2020, right before COVID really hit, and impacted everybody. Can you go to the next slide, please? Thanks. I'm just going to tell you a little bit about Family Health Associates. So we were established in 1955, and it's a second generation. So several of our doctors here are second generation doctors. We're independently owned. Currently, we have 2 locations, one in Hermiston and one in Umatilla, and we are soon moving into Boardman. Actually, we're starting a small satellite clinic this month, so that's kind of exciting for us. We're a rural health clinic for both Umatilla and Hermiston. We're a PCPCH Tier 4. Currently, we have 8 providers, 3 doctors, 1 physician assistant, and 4 nurse practitioners, and hoping to add a 5th nurse practitioner in the next couple months. So next slide, please. So what does staff vitality mean to FHA? We want our staff to be proud to work for us. We value each of them and want them to feel valued. We want them to have advancement opportunities, and we want them to have that happy, healthy work-life balance, which we know is, especially with COVID, has been really hard. When we got hit really hard in our community, we did a lot of COVID testing, and we saw a lot of patients, and we had a lot of burnout. So next slide, please. So just want to touch base on what we do. So how we gather our feedback, we used to do just quarterly staff meetings and kind of just open the floor for discussions on issues, concerns, comments, kind of the template off of what, for the tools that she had sent out. I do warn you though, when you open the floor, sometimes it can just be a complaint session. So you kind of want to make sure you stay on task, make sure you're not getting that negative, like front versus back, which I'm sure probably a lot of clinics have as well. Like the front can work on their communication, the back can work on their communication. Then with that, the results are discussed with the medical director and management team. And this year we did digital surveys, which kind of, it was a good route because you didn't have a lot of negativity together, you know, teaming up together, I guess is what I want to say. Next slide, please. So I just want to share our survey results for the first quarter. I'm just going to let you guys, if you can all see it, just take a minute to kind of just go through it. This is the questions that we asked in our survey. I was kind of a little taken back because I felt like I try to do a good job with my management team to make sure that our staff, like, we're investing in their cultural initiatives and how they feel here, if there's career advancement opportunities for them. Alarming to me was how many people had recently thought about leaving. So I discussed with the management team on that, like I'd like them to spend a little bit more time with their MAs, you know, when we do our goal, because we have monthly goal meetings with our MAs, kind of just talk to them about where they see themselves in the future and career advancement opportunities. And then with the front office as well, each department. Next slide, please. And then how we share the data is I'll send out a staff email, or we do have a lot of quarterly staff meetings, so we can share all the updates. And again, we do open the floor for comments and discussions. And then we created a company newsletter where we share, here's what we've done from our survey. You know, we came out with our front office needed restructure. So we kind of, in this murmur that I added to the slide here, was just kind of how we're going about it. Next slide, please. And then the responsibility of the implementation. So once the data has been gathered, I kind of go through it, and then I put my comments, what I think, just to share, like, why do they have questions? Why are, you know, some of the comments were, they felt like they weren't heard in some aspects. And so I kind of share that, like, we need to address that with the management team. You know, if our staff feels like they're not getting heard, we need to fix that. That's an issue. And then we strategize over that, and then kind of pick a couple areas that we can improve. And then with approval from the medical director, then I delegate it down. And depending on what department, it may affect the whole clinic. So it might be all 3 managers that will do that. So next slide, please. So far what we've done, we created an employee recognition program for employees. If they see their employee or a coworker going above and beyond, they can just write a little snippet and say, hey, you you had great customer service with this patient, you went above and beyond. And then we have a little box where they can put them in. And then at the end of the month, we go through them and we give them to the employee so they can read those. And then they have a little trinket box. They can pick out little goodies. And whoever gets the most, we give them we reward them with a gift card, maybe like a Amazon gift card or a coffee card or something like that. If we see it on the management side, we'll do on the spot awards. We have perfect attendance awards. Like I said earlier, we created a company newsletter. As an office, we have attended fun runs. And the biggest project we tackled because of COVID is we restructured our whole entire front office. With COVID, we had, I'm sure everybody else experienced this too, but we had a problem keeping a lot of our front office staff. There was times where we only had 2 people up front. So when we hired, it was unfortunately throwing them into the position and not giving them, the training that they really needed. So we restructured that and took some of the job duties and reassigned those to the business office where they could check same day insurance and insurance for the patients. We also revamped the workflows. So also what we've done is when we reach goals, we reward them with the small victories we try to celebrate. We hired a massage therapist that came in and did 10-minute massages for each of the staff that wanted it. We do lunches and coffee and donuts, that kind of stuff. So next slide, please. And then how we monitor that is we're getting ready to do a new survey just to see if we've improved on these areas. So I'll send out a new survey probably this month. Have we improved? And do you guys have any other suggestions? And so this year, one of the recommendations was any new leads or supervisors that get hired that we offer like HR leave laws, especially with the Oregon leave law changing. So that was a good, and then effective communication as well. So next slide, please. Does anybody have any questions for me?
There's a couple questions in the chat here. Link it to the first one. The first one is, what have been some of the biggest differences you've seen in your staff since implementing staff vitality activities?
Well, you're always going to have some negative staff, but overall, I think the camaraderie between the front and the back has improved. I think we had an issue. We had our IT. We had some of our newer folks on Teams and our other staff on Link, so it was really hard to communicate. And since that has fixed, that helped our communication, and that helped actually the overall staff. But I have seen improvement, but you still have the negative, some people just won't be happy, but I have seen a big improvement.
Yeah. The next question here was, when a staff meeting turns into what you were talking about, like a complaint session, how do you make sure staff feel heard without letting too much of that negativity seep in?
What I usually do is I say, well, hey, why don't we save this and you can come in and talk to me about this, and kind of turn it into a one-on-one, because maybe there's something bigger there than, there's just complaining, you know what I mean? Mm-hmm. So I pull them in and try to address it that way.
Yeah. And then the last question that's in here, you were talking about you have some different culture initiatives amongst your staff. I was wondering, the question's wondering if you could expand more on that.
Yeah, so let me look at my notes here. I'm so sorry. So on that is just like how we do, as far as we want our patients to be treated fairly no matter, what, and just how we go about addressing patients and staff. And if we've all, sorry, I'm kind of nervous today.
We all are. It's okay.
Just really overall how our culture is, we do have some staff that gosh, I'm sorry. That really got me, that question. That's a good question.
Are you speaking to like the culture of your practice and kind of cultivating that internal practice culture? And so like, what are those, I guess, like, what are those things that you are doing to cultivate that?
Yeah, you know, it was actually at the start when we did our survey and we came back with that. A lot of our staff didn't know our mission statement, our vision statement. So what our medical director, and I think it's great that he did this, what he did is he sent out to, in our murmur, in one of our newsletters, said, what does it mean to you? What have you done? Here's our mission statement. What have you done? And then he had each department come up with their own vision statement, which was really good. And some blew me out of the water. They just really nailed it. So
yeah,
thank you for that.
Absolutely. I mean, it sounds like a great way to help people see the value in the work they're doing every day. Yeah, it was a great example. Yeah, exactly. As the chat says, it was a great example. Love the example. So, any other questions from our chat? Or I don't see anything else, but that was, Jolene, I really want to thank you for joining us today and sharing kind of how you all at Family Health Associates are doing this work.
Yeah, thank you.
Thank you. All right, I think we can go to our next slide. And with that is our next clinic or practice that is going to be sharing with us, which is Evergreen Family Medicine. And so we have Beth Bunt with us, and I'm going to pass it over to you, Beth.
Hi, everybody. Thank you for joining and asking me to speak. I work for Evergreen Family Medicine. I've been there for about 8 years with multiple hats on. We are a series of clinics in Douglas County. We actually have 3 of those little red pinpoints that you had in the county on your map. And so we have 2 that are in the same city of Roseburg, and then we have 1 in Myrtle Creek, and we have a new one in Sutherland that's only 2 weeks old, just open. So for Jolene, we feel your pain with opening your new clinic. And so hopefully that will become a PCPCH as quickly as it can as well. Our other 3 clinics are 4-tier PCPCH clinics. Our cities that we have our clinics in range anywhere from a population of 3,500 to Roseburg has over 23,000. So it's kind of a big range, and we work together with as many things as we can, under our Evergreen umbrella. But each clinic kind of has its own hardships when it comes to employee engagement and retention, depending on, city size is a factor, commute time, things like that, because we're so spread out in our county. And so those are definitely things that we deal with. We currently have about, I think, 25 family practice providers combined right now total. We have a bunch more onboarding at the end of this year and the beginning of next year. So we're still growing. Our new Sutherland clinic isn't completely full yet. So until we have every nook and cranny filled with an employee or a provider, I'm sure everybody feels that as well. We have about 240 employees combined, along with those providers. And in addition to those family practice providers, we also have multiple specialties. So we have urgent care, occupational medicine, women's health, and endocrinology. So there's lots more providers kind of all rolled into that. But our total patient base actively is about 25,000 patients total. And so, depending on where you're at, if you're in the Myrtle Creek office, it feels very small. If you're in one of the Roseburg offices, it feels very big. And our employees really are trained to be able to go to any clinic wherever the need is. And so we do share employees when we have to. If a provider is out, say in Myrtle Creek, our providers will go down and help cover so that way there's not a big gap. So that's kind of collaboration that we do really does help with all of these things we've been talking about. So that's good. With our 240 employees, you can go to the next slide. Our employee engagement and retention is a very, very important factor. On the icebreaker, when she asked if how we understood the measure, I put a 5 because we understand it greatly, but how well we're doing, I would say we're between a 3 and a 4 because I think it could always be better. I think that we are very, very lucky at Evergreen that our administration is really, they have huge buy-in with this measure, and really, they're the driving force for this. If they didn't have the initiative to do this, or the investment in it, then we wouldn't be, as middle management, we wouldn't be able to invest in the time and the money and all of those things that really help us to be successful in this measure. It's definitely starts from the top. Dr. Tim Powell, our CEO, he's also the founder of Evergreen, has an amazing mission statement, like Jolene said, that is really huge for employees to be able to understand and know. That way everybody's on the same page and really is moving forward with the same goals. That's him in the picture there. He's in that picture, he's grilling burgers for our staff to celebrate the end of the pandemic. And so that was when the public health emergency ended. We had an outside barbecue, and administrative staff. That middle picture is our part of our HR team, and Kim Tyree, our COO, and our admin staff serving employees. That was one of the things that they listened to about staff. Everyone, was murmuring and super excited and grateful, and really wanting to celebrate somehow in a way, that and so that was the admin staff did a barbecue for all of our staff, and so that was really nice of them to do that. So for us, there's no downtime when it comes to engagement and retention. It's something that in every conversation we have to be thinking about it. Every meeting we have, and really truly admin giving us the time and the resources to be able to do what we do is super helpful. You talked a little bit about provider burnout. And, for us, having so many providers, that's very, very important to us. And, we have worked really hard to make sure that not only staff have what they need or what they want, or that they feel listened to, but that all of our providers feel the same way. You can see in that picture on the left of the screen, that's actually providers and their families had a flag football game at Dr. Tim Powell's house. They had a big provider social with all their families, so that some of our newer providers could essentially make friends in our community. We had a few that had just moved here, and so trying to really form a family type community for our providers was super important. And so like I said, we're really grateful to have our admin staff be really spearheading this whole thing for us. You can go to the next slide. So as far as, all of the staff is responsible for doing this every day. So it starts with administration, and then they kind of made plans as to how they were going to dedicate funds and time to this, and gifted that down to us as management. As managers, we have made sure that in our own departments, that we're following our group strategies, that we're making sure our employees feel heard, and then it goes all the way down to our specific team leaders and our representatives. So each department or group in our clinics have a leader or a representative. We have regular meetings where in whatever they hear in their morning huddles, they can bring to the bigger group, and then there's an even bigger group and a bigger group. And then all the way down to the staff and their families, even someone who's only been here a week. We want to know, what is their family engaged in? What do they like to do outside of work? And really find out what drives them, because if we can help them have that work-life balance, then we can have a more successful employee. And we found that that's super important with providers. And when we very first started kind of our wellness and life initiative, we found that some of our newer providers, when they were moving to the community, that the family members of the providers kind of felt isolated. So making sure that we had, our welcoming committee and that the spouses of the providers, were met with resources from the communities that we, from simple things to, giving them gift baskets that had brochures from the various places that were available in our area, or that groups of other provider spouses took them to lunch, things like that, to make sure that we really integrated the whole family, not just the provider that came to work for us. In some of these pictures that you're seeing, all of these are really activities that have come from this initiative. And so we have employee craft nights, where employees are encouraged to bring their family members as well. Halloween is really, really big at Evergreen. And so administration allows us to, on downtime, completely decorate our whole departments. We hand out candy for the kids. Had a little hiatus during COVID, obviously, but staff really enjoy being able to express themselves and show up for the community. We've done ski trips and hikes with families. We have celebrated staff as superheroes. We allowed them to wear their superhero t-shirts on Superhero Day, and bowling and all kinds of activities, with a main goal of trying to do something that each employee would enjoy. You can't do any one activity that everyone is going to want to go to, or everyone's going to want to enjoy, because some are single, some have families, some are not social and want a small gathering. So we're really trying to branch out and find something for everyone. You can go ahead to the next slide. So one of the ways that admin has allowed us to do this is that they mandated or gifted us the ability to create what we call the Wellness and Life Committee. This is a group of employees. No administrative staff is allowed, but we have providers, we have representatives from every type of staff. So we have clinical staff representatives, front office staff. We are a big group that really bring the thoughts and ideas from our own departments and bring them to the committee so they can be discussed and find what employees really want. And so with that initiative, we were given kind of in the first year, we were given just carte blanche. We just come up with any idea that you possibly can. Everything is welcome to come to the table. And then we just kind of chewed on everything to see what would work, what wouldn't work. We did we've done for many years, a big Press Ganey survey about employee engagement to see how things are going, how employees feel. And so we had been doing that a couple of years in a row. And one of the things that I'm sure comes up on everyone's is lack of communication. Nobody feels communicated with, no matter what. Every year when it came up, we would do as best we could to make sure that everyone was feeling communicated with, that if a decision was made, that the right people were, in the loop in time, things like that. And with that communication always being an issue, and with Wellness and Life, it was one of our first things that came up as well. Administration said, give us all the ideas. What can we do to make this communication work? And our intranet was born. And so what you're looking at here is a screen from our intranet. And they did everything. We started town hall meetings. We started the intranet. We started, we have what we call Spirit TVs. So we have big screen TVs in every break room of every clinic that show announcements and things that are happening and what's coming up next. And our employee appreciation, if somebody did a great job or we had great comments from the community, those all get plastered all over our Spirit TVs so that employees can see those when they're taking their breaks or they're coming in and clocking in for work. All of those things came from employee input. So we tried, little things at first, and then we just said, we're going to do them all and see what works. We did PDSAs with all of them to make sure that they were functioning, that they were actually getting the information out there. And they all really have worked. And so we've kept them all. And so with our intranet, so this is our wellness and life page. So this is our committees page where we get to advertise the things that we have going on. You can see on the left-hand side, it allows us to take polls. So any employee can click on and answer questions. We can throw small polls or big polls up there. We can, say, hey, we're thinking about doing a game night. Is anybody interested? And just get like a basic number of who might be interested. And so then we can advertise things. We do things like, so we have our activity calendar on there. You can see a tab for that. We do a mindful calendar every month. And so that just gives the employees a positive thing to do or think about, or, some sort of action to do every day for the month. We're currently doing what we call Miles of Smiles, and it's a fitness kind of challenge. And so every department is logging their miles that they work out or walk or bike. And so we're keeping track on a map to see how far our employees can go across the United States. And so really getting this employee input happens from the moment they walk through the door. So with onboarding, employees are urged to click on the choose your own adventure. So by clicking on a kind of group that they want to be a part of, they'll get special announcements. So if someone says, well, I want to be a part of the outdoor group, then anytime we plan a hike, they'll get an email. Anytime we do a game night, if they said they want to do small group activities, then, if we're doing a card night, then they'll get an email. Talented team players allows the employees to let us know what they're good at, or maybe someone teaches yoga and wants to do a yoga class, or things like that. And then obviously any questions or comments. And then we have a separate page for employee engagement and vitality, where we actually do our mini polls and really find out how we're doing, so we can track that. So we do that large Press Ganey survey every 2 years. And then in between that, we took some key survey questions off of that, and we do those, what we call the mini polls, or the, and then on this front page, we do our regular interest polls, like, what kind of thing are you guys looking for next? Does anybody, for instance, we just did lunch in the grass. As soon as the weather got good, we put music and lemonade out in the grass, and just over the 2 hours for lunch, and everybody just brought their own lunch in their chairs and went and hung out. So just little things that really are getting people to spend time together and engage, especially across departments where they don't normally spend time. So you can change slides. So this is when you click on that engagement and vitality page, this is the one on the top is the one that you get. And so it talks about, that we are listening, we do want your opinions. And so on the left-hand side, you can see the poll that is our kind of mini questions. I mean, I think that they did, you guys did a screenshot of this so that you guys can actually read it in the handout that you guys are going to get. So you can kind of see the questions that we ask. Evergreen excellence, you can see on the right-hand side, that's the one where we can leave good comments or feedback about fellow employees. If there's somebody who really provided good patient care, those also end up on our, not only our intranet, but our Spirit TVs as a big announcement with the employee's picture stating, whatever quote it is about how they did. And for us, we knew instantly that this was working and that this was helping with communication. And part of that has to do with the internet or intranet. We can track engage or interaction. And so there's just a little screenshot on there that on the first day that we made this live, we had 203 clicks through our pages. Whereas our intranet had been around for about 6 months to a year before we started the Wellness and Life Committee, and our highest trafficked page was about 93 clicks per day. And so we were really excited that this one had really, our activity page was really popular. So we knew that employees were really engaging in that. So this is something we can track and pay attention to as we go. And if, we're putting something up there and it's really not working, it's kind of obvious, or, to say, hey, nobody's signing up for this activity, we can go and look and say, well, it's only been clicked on by 3 people. We must not have enough announcements out there, or, things like that. And so really being able to see the change in employees is really what helped us. It's one of those things where you do the PDSA and it's like, well, what is your measurable proof? And the proof is in what you see in employees. You see them happier, you see them engaging, you see them talking with employees in the break room that they've never met before, because they happen to be in a group activity together, where without this, they wouldn't have put them together. Listening to the polls, we've done things like give management increased trainings on how to evaluate how employees like to be appreciated, learning what gives an employee confidence. So we've done management trainings, our behavioral health team has done like work-life balance classes. So at lunchtime, they'll talk about stress or, some ways to, do exercises during your break times and things like that. So there's lots and lots of things that we have going on, and they all come full circle when you start with admin and come all the way around to really see this come to fruition. It's very cool. So that's kind of us in a nutshell. I feel like I talked really fast. I'm sorry. The biggest thing for our feedback sharing when you talk about that intranet is our front page, is that we, with those announcements and TVs, we can let everybody know the progress that we have, or the results. For instance, it was interesting when I did my screenshot, we were already we had done a poll about PCPCH for employees. It had been a little while since we'd done like any kind of a full office training or revamped our initial onboarding training about PCPCH. So we wanted to know what employees knew about PCPCH, so that we could, if we needed to revamp what we had going on training wise, we could. And so if employees click on that, it will tell them how that poll resulted. What you see on the side, so we call our intranet spirit, because our goals and values that come from Dr. Tim Powell are stewardship, patient and population focused healthcare, integrity, respect, innovation, and teamwork. And one of the things when we talked a little bit earlier about culture, that has really helped us is to try and integrate these values in every single thing that we do, even down to, if you have, two employees in your office that are having some sort of conflict and they're not getting along well, to ask them, like, what you're trying to get from your coworker, how does that fit into our values? Like, what is it that you're trying to accomplish that fits into this category here? I don't feel that what it is we're talking about here really hits home with us in the stewardship category, or how can we change what we're doing to make sure we fit these values? And so it's been very helpful to have this, especially as middle management, to kind of fall back on when you're having those employee conversations. And so it's really helped us to surround ourselves with employees and providers that really have the same values. And so that has helped build that culture. And then I forgot to mention that Dr. Tim, our CEO, also does yearly progress and goals, and all of those come from the employee and provider feedback. And yeah, so we're good, and I'm done.
Great. I think is that the last slide?
I think that's the last one. Yeah.
Great. I know there were a few comments in the chat. I know Jolene was mentioning that she loves that committee, hoping to add that to that family health associate. And I know Daniela from Yakima Valley was saying really liked how you use the internet to gather feedback. Mm-hmm. There were a couple questions. I'm going to start with the questions for you guys. I know there was the question, does the wellness and vitality page go out via email, or how do employees find these communications?
So for us in particular, we have announcements that anytime we post something, if we want it to be a full announcement, it will alert kind of like an instant message to all employees when they log in. But for the most part, our homepage has those tabs at the top, and they just click on the tab that says wellness and life. And so if they're actually looking for it, they can see it there. But for the most part, when we want everyone to really know something without seeking it out, we put it on the announcement and the Wellness and Life TVs. And, you know, worst case scenario, we print out flyers and put them all over the break room and and things like that. So it's not all digital. We do a lot of analog stuff as well. But that is just one tool that really does help us.
Great. The next question is, what advice would you give to practices who are at the very beginning of developing these staff vitality activities?
So I think the biggest thing is making sure of where you're putting your resources. You know, there can be something where the whole committee thinks like this is a really great idea, and then we start it and we spend a ton of time on it, and then we find out, well, we only have 4 people signing up. Why is that? And so really doing those polls, the preliminary polls, is super helpful for us. So for instance, you know, with, I don't know if you saw, but we had a flyer on one of those pages for a EFM softball game that we were doing. And before we even spent a ton of time on it, we asked, we said, this is what we're thinking about doing. If we were thinking about doing this, who would be interested? And so we did a poll and got kind of a basic count of like, wow, we have, you know, 50 people that would love to do this. Obviously, that's not our whole 240 employee base, which we would love to have everyone, but 50 is a lot. And so then we knew it was worth our time to really get invested. So you can do that via email. It doesn't have to be intranet. You can do slips of paper, hand them out, fill it out, put it in a box. So it doesn't have to be techie like that. But definitely doing those preliminary polls and letting employees know this is what we're thinking about doing. And then that way, once you say you're going to do something, you can actually come to fruition with it. You know, one of the worst things is to plan something and announce something and have a handful of people be really excited about it and then have to pull out of it because it didn't work.
Mm-hmm. Sure. And I think this last question is for both you guys, so for both Beth and Jolene. It's from Andrea asking, how does cultural diversity awareness apply to your staff when working with diverse cultural patient populations?
So since I'm the one unmuted right now, I'll start with that and then you can pass it to Jolene. The biggest thing for us is to just make sure that if you are treating the patient the way our values are listed, then none of that stuff matters. It's not anything that you see, but you still need to know where they're coming from. You need to understand their culture and the, you know, things like the way that you should talk to them. And so really training and having those discussions, but making it an everyday discussion. So it's in the way we talk to people, and you know, when we do our onboarding, you know, we're discussing how to address people, you know, how to be professional, how to make people feel comfortable with you as a professional. And so I think that's the biggest thing, is just to do it in everything that you do. And then when someone has questions, make sure you have good training resources to kind of fill those gaps.
And Jolene, was there anything that you'd add to that?
No, she hit that right on the head. A lot of our providers say, how would you want your family to be treated? Treat these patients as if they're your brother or sister or mother or father, you know, and I think that goes a long ways.
Great. Well, I think that's a really great segue. The last thing I want to tell everyone is that we are having another learning collaborative session. Literally, to go to the next slide, I believe the link will be, or it talks about it there. But in our next learning collaborative, we will actually have some people who are going to come and talk about how to address their diverse staff needs. We're going to have a little panel discussion on that. We'll have some more practice sharing. So if you're not already registered, I would encourage you all to register for that. A copy of these slides will be sent out to everyone after this. So we'll have all of the links in that. I just want to thank everyone for joining us today. Thank you, Beth and Jolene, for presenting. It's been a wonderful conversation that we've had. I really appreciate it. I hope everyone has a great rest of your day.
Thank you.